The overall aging of America affects healthcare as much as any other field. For example, more than 60% of our currently practicing psychiatrists, who provide a significant portion of behavioral health services to patients, are over age 55 and are likely to retire within the next decade. So, how to recruit, train, and retain enough people to meet the future demand for behavioral health services in our nation? Integration may hold the key. Welcome to Advancing Health, a podcast from the American Hospital Association. I'm Tom Hedderly with AHA Communications. In this podcast, hosted by Rebecca Chickey, Senior Director of Behavioral Health Services with AHA, we hear how the dismantling of the traditional silos between behavioral health and primary care practice benefit patient and provider alike. Her guest is Panuska, a clinical psychologist and manager of behavioral health integration with Endeavor Health in Illinois. Dr. Panuska shares real-world examples of how integration can increase workforce productivity, satisfaction, and retention for both primary care and behavioral health clinicians.
Dylan, thank you for being here today with us. To set the tone, can you please share just the workforce shortage realities in the behavioral health workforce? Maybe provide a couple of examples of what's going on in your own organizations, challenges around recruitment, retention, worker satisfaction. Just give a sense to the audience of the realities that are going on in the field right now.
So, healthcare is stressful, right? And takes a special set of characteristics and person to be drawn to that field. And the workforce shortage is also really coming about from just, particularly in behavioral health, a huge increase in demand for behavioral health services. Where, I mean, really, there's just simply not enough behavioral health professionals across the spectrum to meet the demand, particularly staying within traditional models of care. I came across one thing in my research for the podcast that in 2021, the American Association of Medical Colleges reported specifically for within Illinois that we had the capacity to meet just 24% of the mental health need in the state with its current workforce. That is staggering, really alarming. Within Linden Oaks and Endeavor Health, there's not necessarily something that, as far as the workforce shortage goes, that makes us unique in not feeling that. And I think as an industry, it's really about looking at what are some different solutions and innovations that we can implement to better meet the demand for services, while also keeping retention and increasing recruitment of qualified practitioners.
And I think that's what we're here today to discuss. That is one of those solutions, not the sole solution by any means, but one of the solutions is the value of integrating physical and behavioral health care and how that can help with workforce satisfaction, recruitment, and retention. And I'll add another really just soul settling statistic to the one that you shared, and that is over 60% of our current psychiatrists, and admittedly, behavioral health work is done by a broad team of individuals in the field, whether it's psychologists, social workers, counselors, marriage and family therapists. So we're not just speaking about psychiatrists, but just in that one specialty area, 60% are age 55 or older. And while not everyone wants to retire at 65, a lot do. So just looking out over the next decade, there could be a significant drop off in the current workforce. I know you've had some experience at Linden Oaks, which is now part of Endeavor Health, integrating physical and behavioral health. Can you share how you've seen it help improve worker satisfaction and retention of those workers?
So I've had the distinct privilege and opportunity to grow our behavioral health integration program over the last 10 years with Linden Oaks and Endeavor Health. I was fortunate enough to be the original pilot person for it. So one of the areas that behavioral health integration really helps with retention and recruitment is through each role being able to practice within their scope and better supporting other disciplines. I describe it this way often where really the magic of behavioral health integration is the patient is able to receive both their behavioral health care and their primary care within the same setting. And when you have satisfied patients, you also have more engaged physicians, therapists, psychiatrists across the board. One of the other big areas that BHI or behavioral health integration really helps with is it enhances the patient care team and system of care where you can work smarter, not harder.
So let me dig into that last point just a little bit. Working smarter, not harder. That seems to me that's a way to increase productivity. Not only can the behavioral health team be able to practice their full scope of practice to their full license, but they can be able to better support their other clinicians and healthcare workers that are working with the patient. Is that what really helps productivity? Is it also maybe that satisfaction drives productivity? What's your opinion?
Another really important part of it is a lot of patients present in primary care with some component of either psychosocial stressor or behavioral health condition present. By having both of those disciplines in one place, it really keeps a busy clinic working efficiently while also providing high quality patient care. I have two examples just from the past month where patients present in primary care with some sort of behavioral health crisis or they're identified as having some degree of suicidal ideation. And when you have behavioral health right on site to be able to come in for a warm handoff, help with the assessment and evaluation recommendation for next steps, that one helps reduce sort of emotional load or burden on the primary care physician and primary care team, helps make sure the patient is navigated to the most appropriate and safest level of care. And you have the behavioral health expert right on site to help direct those pieces. It's a really fun role reversal, I guess is how I'll describe it, where the behavioral health professional is really helping navigate and guide that patient experience and safety of care.
So I don't want to put words in your mouth. Keep me honest here, Dylan, please. But I think it's a interconnectedness that integration provides between meeting the patient's needs, having the clinicians, whether they're the primary care clinician or the behavioral health clinician, be able to work together to meet those needs and not have that frustration of the physical health need isn't being met or the mental health need or substance use disorder need for treatment isn't being met. That it's that interconnectedness and the ability to treat the whole person that's a key factor in driving improved satisfaction and productivity because you feel better about the job you're doing.
Absolutely. And when we're able to have that like multidisciplinary approach and easy access of communicating, for primary care, that's with behavioral health, and with behavioral health, that's, of course, having greater access to the primary care physician and the primary care team. Coordination ends up being just so much easier, where historically healthcare has functioned in big silos. And so it's been hard to, for primary care to know what behavioral health's doing, and vice versa. And from a productive standpoint, it can help reduce like duplicative work. And then also it's making sure that the correct role or person is helping a patient navigate one of their needs. So as a psychologist, I'm going to be much more tapped into not only the resources that are available to a patient from a behavioral health standpoint within our own behavioral health, Linden Oaks Endeavor Health System, but also what other resources and opportunities are available to the patient within the community and how to help get them connected. The other thing that I'll say a lot about behavioral health integration, particularly in busy primary care practice, is we give the gift of time. When there's a behavioral health component, that can really take a lot more time to fully and adequately address. and primary care physician and mid-level NPs, PAs schedules are overloaded. Back to that idea of workforce and not having enough primary care physicians either. When you have psychology or social work professional counselors on site, that warm handoff takes place. So we sort of step in and help navigate and manage behavioral health needs, and the primary care physician is able to move on and stay within the bounds of their schedule, also leading to happy physicians. So Epic, our EMR, the most common EMR, but they have a term they call pajama time. So it's time spent from healthcare providers outside of office hours in Epic, documenting, responding to in baskets, things along those lines. When behavioral health is on site and integrated, it can help reduce that amount of pajama time or time spent outside of the office, not just from a pure time and in basket or documenting standpoint, but we all get into this field because we're compassionate and drawn to help people. And so the mental load of wanting to navigate somebody and not knowing how to do that weighs on people. And so now they have immediate access to the team members that can really help offload or unload that burden that they've really historically have carried.
That's great. I think one of the things I would say is that the magic of integration, I'm loving this word, Dylan, I'm going to use it over and over. The magic of integration is to allow time for all of the individuals involved in the treatment of a patient to decompress. They may still have pajama time, but it's not going to be spent on the EMR. So that's a good thing. So just gotten a call from a primary care physician who's leading a small but mighty multi-specialty in primary care. I mean, so family medicine, internal medicine, et cetera. They're considering embracing integrated care to convince them to do so.
In my experience in growing behavioral health integration at Endeavor Health and Linden Oaks, where I've been mostly successful is in starting with the why we should integrate. And when you're able to start with why and have solid positive patient stories to help support that, that's really where it starts to sell itself. At the beginning of it, when we were looking for a pilot, it's like primary care is designed for, well, primary care. What if we bring all these patients with behavioral health conditions to the practice? And back to the why, it was, well, they're already there. Adding behavioral health integration, the why to it is really to help better treat and improve the lives of patients through whole person care. And then one of the other things I'll say is behavioral health integration is hard, but that's okay because hard things are hard. Or the other way I usually describe it is primary care was not designed with behavioral health in mind. So it requires somebody and a team of people to be very persistent and clearly communicating and engaging all of the stakeholders along the way. And one of the things that can be challenging in behavioral health integration is really everybody has to be engaged and shift their idea of how both primary care and behavioral health meet the patient's needs, including the patient. It is not a traditional model of behavioral health, and it is so much more than just a brief solution focused individual therapy. And what's really amazing is when you bring these two pieces together, it really ends up being more than the sum of its parts.
Integration is more than the sum of its parts. Integration improves outcomes. It's a magic that can give the gift of time. The gift of time goes to all of those involved in the treatment program, but to the patient as well, because when they're able to have more time to live a healthier, productive life, that is, as my father used to say, without your health, you have nothing. Having better health, it's priceless. We can't put a price tag on that. So, Dylan, thank you so much for sharing your expertise and time with us here today. We're very grateful to you and to your team, and keep up the great work.
My pleasure. Thank you for having me. And can't imagine practicing psychology any other way.
Thanks for listening to Advancing Health. Please subscribe and rate us 5 stars on Apple Podcasts, Spotify, or wherever you get your podcasts.